Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I have broadcasting from the administrative offices, and our special guest is Christine Powell, BSN, RN, with Aultman Birth Center. Good morning and welcome to the show.
Good morning. Thanks for having me.
Okay, we'd like to remind our listeners today our program is available on our podcast. You can just look for that in your favorite podcast app. Look for Health Matters with the Medicine Center Pharmacy, and we'd love for you to please subscribe to our program. September is Baby Safety Month and also Safe Sleep Awareness Month, and that is going to be the focus of our show today.
So, Kristen, tell us about yourself and your career with Aultman.
So I have been a nurse with Aultman Hospital for 30 years, just started my 30th year this year, and have worked in the birth center the whole time. So always have had mom-baby care has been my specialty. I started actually working as a nurse on the floor and then teaching childbirth education classes, so prenatal classes to everyone expecting babies. So I started that pretty much right from the beginning about 29 years ago. And then that kind of rolled itself into other educational roles. We offer a class here for new moms after they have a baby on how to care for themselves and their baby. Taught that for a long time. And then worked into a role of community outreach where we do lots of education out in the community. And that has a lot to do with building relationships as well, and just having resources for families. And then my most recent position has been the bereavement coordinator. So that's I'm coming up on 2 years with that position. So lots of different roles, different ends of the spectrum going on here, but very passionate about mother-baby care and families and offering education so that everybody can get started on the right foot.
In your 30 years, how many babies have you seen? Do you know?
Oh, I have not done the math. I haven't done the math. I was going to say it's great that I started being a nurse when I was 12 years old or whatever, so that it didn't make me feel like I'm actually as old as I am. But I need to do that math someday, maybe.
Wow.
Mm-hmm.
So what is the first step in keeping infants safe?
So, babies, well, if we want to say infants and baby safety, really everything starts even before conception. If we build that strong foundation of being healthy before we decide to start a family, that is going to get you on the right path, obviously, from the beginning. And then seeking good prenatal care, maintaining that care, and then following all the education and things that you learn along the way after your baby's here. So I guess to summarize that, we say very first starting with preconception care, making sure that you're healthy before we conceive, and seeking good, consistent prenatal care once you are expecting a baby.
Wow.
So you really can't start prenatal care too early.
Correct. Correct. Yes.
Okay.
And just, simple things of if you have underlying health conditions prior to pregnancy, or maybe some unhealthy habits, whether you maybe perhaps are a smoker or don't have great eating habits, or maybe need to take some vitamins, things like that. Getting those kind of things in order prior to conceiving is always a good idea. Now, as we all know, that doesn't happen all the time. Sometimes they surprise us and they're like, "Oh, we're having a baby," and you didn't have time to do all that. But then that's where prenatal care comes in, and you seek care from your healthcare providers early on and consistent, and that sets you up for a healthy pregnancy, healthy baby.
So, you mentioned a couple details. Can you talk about why prenatal care is so important during pregnancy?
Sure. So prenatal care, when you seek prenatal care, you're getting evaluated by someone consistently. And that's not just for babies' well-being. They screen moms also. So you're getting a blood pressure check. You're having a urine test when you go. And then as far as baby is concerned, they're doing checking for fetal heart tones, making sure baby's heart rate is nice and strong and regular. And then as things come up along in pregnancy, if you're seeking that prenatal care, we can intervene early and treat early. So, for example, like gestational diabetes, which is, diabetes that occurs during pregnancy. If you're getting that consistent prenatal care, that's going to be detected early, easily treated, which allows for a healthier baby at delivery. Same with preeclampsia is another condition we see a lot, which kind of it's quite involved, but one of our most common presenting symptoms of that is high blood pressure, which can be very dangerous for both mom and baby. So when you're getting that prenatal care, you are catching those things before they get out of hand, and we can't really, get a grasp on it and kind of regulate your care. So, and just as a little statistic, those who seek prenatal care are who do not seek prenatal care are 3 times more likely to have a low birth weight baby. And they are 5 times more likely to have a baby that does not survive. So that's seeking that regular prenatal care is extremely important.
Well, I know that, maintaining your doctor visits is important. We have all too often kind of a little segue, patients that come into the pharmacy that don't have a regular doctor. So, it's clearly important to have a regular checkup on an annual basis, let alone seek prenatal or OB care as you're venturing into becoming a mother. So,
Right, for sure. And it's a challenge too in our area. We have great physicians, and they are pretty busy. So it's something too, you need to be very proactive, get yourself in there. As soon as you have that positive home pregnancy test, you need to be on the phone making those appointments and getting in to see someone.
Gosh. What role does mental health play in pregnancy?
Well, mental health is a big focus in our community, our world, right now anyway. So if you have a existing condition, which most commonly what we see are anxiety, depression, pregnancy can kind of exacerbate or exaggerate some of those conditions. And, becoming a parent, whether it's for the first time or the fourth time, kind of produces some of those feelings anyways. So when we have those underlying conditions, it can make things a little tough. So you want to make sure, again, that it's kind of the holistic care, that making sure that you're taking care of yourself, not just physically, but emotionally and mentally, so that we can provide the best, life for our babies, newborns. Lots of things, even when we don't have, if you are not diagnosed with any sort of mental health issues, pregnancy can kind of make you feel those things as far as, you have, sometimes it's a financial stress, sometimes it's a relationship stress that you're worried about and anxious about. So it can cause a little bit of that. And then we all know there's some hormone changes that go on with pregnancy as well. So that can kind of add to those feelings. But we just can't ignore any of those underlying things. Also medication, if you're on some medications prenatally, we want to make sure that those are all safe during pregnancy. If they're not safe, we want to make sure that we get a new treatment plan in place so that we can just stay regulated and stay good throughout the pregnancy and delivery.
So what role does mental health play with after pregnancy and infant care?
So it kind of, it's an ongoing thing here, right? So I mentioned hormones in pregnancy. That doesn't stop the second that baby is born. In fact, after delivery, most women experience a little bit of, we call it postpartum blues or baby blues, it can be called. And that's a lot of physiological changes in your body. You're going from your pregnancy hormones to your non, your body kind of has to transition through that. You're also physically exhausted, emotionally exhausted from the whole experience itself. And so most of the time that small time frame where we experience the baby blues, we can kind of narrow it down to about a week or 10 days on average, where you're just most of the time find yourself a little weepy, a little extra emotional. Somebody asks what's wrong, and you're like, I don't know. And they're like, why you're crying? I don't know. And some of that is just like that physiological after effect of pregnancy and delivery. But where we want to pay attention is if it continues on past that initial 7 to 10 day time frame. Postpartum depression is a real condition, affects a lot of people in our world and our community. And then even more severe than that is postpartum psychosis. That's more highly unusual to come across that, and definitely when there's nothing underlying, no pre-existing kind of severe mental health issues. Postpartum depression itself it can happen anytime from birth until a year after a baby is born. Symptoms vary from person to person, but they typically involve just a lack of desire to take care of yourself, take care of your baby. Extreme ends, you either oversleeping, not sleeping at all, overeating, no appetite. And as we know, babies rely on us 100%. They don't have the ability to feed themselves and care for themselves. So if we are struggling, then we are not going to be able to provide them with the best care. So that can lead to, missed pediatric appointments, for example. So you have a pediatrician's appointment, you didn't sleep the whole night before, you just decide not to go because you can't, you're tired. And then we have a baby who's got low birth weight, and we may miss that, so it kind of spirals into lots of other things. Mm-hmm.
Our first break has risen. You're listening to Health Matters with Medicine. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for a vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine at mid.com. So, Christine, how does someone know if they are experiencing postpartum blues, depression, or psychosis?
So a lot of times the individual themselves may not recognize how they're doing. So it can be people around you who may be mentioning things like, are you sure you're okay? You don't seem like yourself. This doesn't seem like you. Those are some clues that maybe you should kind of self-evaluate, see how you are doing. In the emergent end of things, we want to say always that if you have any thoughts of harming yourself or anyone else or your baby, that is an emergency. That's a 911 call. There are resources available. There are helplines. There are 24-hour crisis lines that can help with those types of things. So we don't want to ignore any of those thoughts or feelings ever. On the lesser end, if you're feeling overwhelmed and can't seem to just get ahead or focus, stay focused, seeking help from, if you have a mental health care provider that you've seen prior to pregnancy and delivery, you can seek assistance from them, or your OB physicians are qualified to assist you in that too. Everybody follows up at 6 weeks after you have a baby. And they're going to go through their questions and make sure that you're kind of on the right path to recovery. And so they'll say, how are you feeling? How are you feeling mentally, emotionally? Unfortunately, that very day at that 6-week checkup might not be the day that you're experiencing symptoms. So then what, so you have to just make sure that you keep that open relationship, that you should never be afraid to call. And you can, explain your symptoms, say, I'm feeling like I can't get 5 minutes to myself. I haven't been able to sleep. I'm not seeing no social interactions whatsoever, maybe not feeling like you're getting help from any friends or family, and explain your symptoms. And the physicians will say like, okay, let's, get you started on this. Let's discuss this. Or, you should not be afraid to verbalize, which I think as a culture, as a community, we're doing much better at allowing people the freedom to say how you're feeling. You think you have a new baby, everything's supposed to be great and fun and happy all the time. And sometimes it's just not. Or some other life curveball gets thrown at you. You say lose your housing for some reason, your lease doesn't get renewed or something. That can just really put a whole dampener on everything that you're experiencing with the new baby. So just again, being verbal, making sure that you're sharing how you're feeling. Friends and family should be a big support. Hopefully most people have that around, but if you don't, again, using your resources, your OB doctor, to get that help. The psychosis, like I said, very unusual. It's a rare thing that we see that, but those are the extreme cases, unfortunately, that we see where when help isn't sought early, terrible things happen. So just again, staying ahead, taking care of yourself so that you can give the best care to your family is ideal.
Is there anything else you want to add about if someone is experiencing any of these symptoms?
I mean, I don't think, like I said, the most important thing, obviously, if we, just reiterating that if you feel like you want to hurt yourself, harm someone else, or harm your baby, that is a true emergency, that you are seeking emergent care for that, um, through either 911 or coming in, to the emergency room. And we're here for that. That's something that our people, everybody is trained in. So just not ignoring it, making sure you're seeking help sooner, earlier is best for sure.
Well, and can you make any comments on how a situation like this can affect the safety of the newborn?
Sure. So I think briefly mentioned earlier how even just on the lesser, on the spectrum scale, if it's anxiety, depression, for example, not feeling the need to get out of the house to get to the pediatrician. So that could be our step one there. But also just kind of maybe neglecting some needs of theirs at home, whether it's um, sleeping safely, feeding on a regular schedule, perhaps. And then on the more extreme end, just, feeling like there's something that, that the baby has, is causing difficulty in your life, and those thoughts of harm that come in. So, um, safety, obviously, we're talking about baby safety is very important. So, just making sure, again, like I can't say it enough, that if you're experiencing any of those symptoms, that you feel open and able to discuss it so that you can get the help that you need.
Okay. Well, let's talk about shaken baby syndrome.
Kind of, that's our good segue into that for sure. So shaken baby syndrome is a real condition. It's something, in all of my years of teaching and being around moms and new babies, nobody has ever said to me, "Hey, I thought it was okay to shake a baby." We all know that shaking a baby is not something that you can do, but it happens all the time. So, why does that happen, right? Most of the time, in the cases when when they're doing their investigations, a baby's shaken because they're crying and won't stop. Um, it can be very frustrating and very tiring, exhausting. And all of those feelings are real. That is something that is justifiable. It is something that is normal to feel. If your baby's been crying for 3 and 4 and 5 hours and won't stop, you're going to feel frustrated. So acknowledging, first of all, that those feelings are okay. It's how you react and how you respond to those feelings, that is the concern. And so making sure that we're aware of things that we can do to prevent that.
What can we do to prevent this?
What can we do? I thought you wouldn't ask. So first things you always want to do if your baby's having one of those moments, is you want to make sure that their physical needs are met. You want to feed them, change them, burp them. Take a physical look at your baby. Sometimes, especially this time of year too, we start when you have a baby and you're at home, you just kind of hunker down. It's nice. You get to stay home. You don't feel like you have to be out when it starts getting cold and all that. You may have just been changing their diapers, not paying much attention. So undress them physically. Make sure they don't have a rash or some sort of weird lumps or bumps or, anything going on physically that you can see. So once you've eliminated all those physical things, then you need to try some soothing techniques. And we teach all these things here when you're in the hospital, but after that initial, you're here for 48 hours maybe, and you're tired, and we're coming at you every direction with all this education. But some soothing techniques, things that we do just instinctively that are meant to soothe the baby is, we shush and we pat and we sway. And those motions remind a baby of being inside mom, where they were safe and secure and none of these outside sources. So we start with those things. You use your bouncy seat, you use your baby swing, pacifiers, music, white noise, car rides, strap your baby in their car seat safely and drive around a little. I always make the joke, don't just get on 77 South and just go. You got to come back at some point. But driving around the neighborhood, something like that can be soothing for a baby. But at the end of all that, if your baby is fussy and you can feel yourself starting to get a little worked up, the safest thing you can do is put them in their crib and let them cry by themselves. They are safe. If you're not holding them, you can't shake them. They're safe in their crib. They can cry. It's hard. It's really hard for a new parent to hear a baby cry, but if they're crying, they're breathing. So, I try to remind parents that it's okay for them to cry for a short period of time. We say 15 minutes, even sometimes they can cry on their own. gives you time to regroup or call in your backup, call in, call grandma, call your friends, your neighbors, somebody who's had a baby before. If you are in a situation where you don't have help or people around, support people, you can bring your baby in. They can come in through the ER. We have a diagnosis, excessive crying. That's a thing. And you can get help here. So you shouldn't ever feel completely alone. You should always know that there is help for that situation.
It's not always a parent that shakes the baby, right?
That is correct. That is correct. Occasionally, well, not occasionally. A lot of people have to use childcare facilities, rely on other people to watch their babies. So just making sure that you're confident, that you are trusting of whoever's caring for your baby, and that they will call you, or seek your help if baby's having a bad day. It's especially hard when you have a baby who has been, we get a lot in the hospital and they're like, oh my gosh, I have this perfect baby. They've been so good. They haven't cried the whole time. I promise it's not going to last. Like, you want to say, yes, your baby's going to be an angel the whole time. You're never going to have a problem. But then you get home and peak crying usually occurs between 2 and 4 months, which is a real bummer for parents, because that's when you start to feel like you got the hang of it. Like after about 8 weeks, you're like, okay, I can do this parenting thing. And all of a sudden they're crying all the time. And you thought, what happened? So they're communicating, right? They don't have words. They can't speak. So that's how they communicate. They need attention. They need change. Sometimes there's, people talk just to talk. So babies cry just to cry. So making sure that everybody understands that's normal, but also when your baby's in the care of someone else, that you trust them to call you. So your baby's having a really bad day today. We've tried to soothe them, not sure what to do, and allow you to make that decision, at that point, how to proceed.
Okay, you're listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we are talking to Christine Powell. Welcome back. Health Matters with the Medicine Center Pharmacy. We are talking with Christine Powell this morning, and it was a very interesting discussion. She sees a lot of babies. How should a newborn sleep when they come home from the hospital? That's kind of scary.
Yes, we want to say we hope they sleep often and quietly and soundly.
Yes.
But there are some rules about sleep, and so I know we mentioned earlier the Safe Sleep Awareness Month. So we're doing a lot to promote all of the safe sleep rules, making sure that parents know what they are and know the importance of those. And so we educate everyone on ABCs of safe sleep is what we is how we explain it. And so the A stands for alone, the B stands for on their back, the C is for sleeping in their crib. And so what that means, the alone part, we mean nothing in their crib with them. So that includes any sort of blankets, bumper pads, toys, stuffed animals. Also extremely important that they are sleeping alone, as physically alone, like not with anyone else, any other person, whether that's an adult or another child, a sibling, anything like that. And then our B for back, we always want them on their backs to sleep. That is very important that we place them in that position when we put them down for sleep. And then a crib, obviously, when we say crib because it fits the the way that we're going about our letters, but we can use a pack and play crib, bassinet, cradle, any of those things that are designed for sleep. The key being there that it's something that is meant for a newborn to sleep in, not something that isn't like a car seat or a swing. Those are not safe sleep areas for babies.
Okay, what should a baby be wearing when they're sleeping?
So that's an excellent question. So we have a tendency, we always want our babies warm. And so we tend to overdress for sleep. And so we recommend our families, less is more is the first thing. We recommend the use of a sleep sack. A sleep sack is like a wearable blanket per se. So it's kind of like, my kids are a little older, but when we use like a gown, it's a one-piece sleep outfit that alleviates the need to have an extra blanket in the crib. So they can wear a t-shirt or onesie under it, the sleep sack over top, and that should be sufficient. The home temperature recommendation is 68 to 72 degrees. That's kind of our zone that we want our homes in for our babies to have the best body temperature. And then, as every home is different, right? So I know, sometimes it's warm upstairs or sometimes it's chilly in the baby's room, whatever. So you need to adjust accordingly, obviously. But if you get up for a feeding, their little hands feel chilly, their feet feel chilly, then of course you can add a pair of, socks or something to them, but you should never be just throwing a blanket in the bed, excuse me.
Okay.
So onesies are okay, socks are okay, but blankets are not okay.
Blankets are not okay. No.
Okay.
No, unless it's a wearable blanket, like the sleep sack. So the reason for that is it's a loose blanket can get up around their face. It can get anywhere. It can cover their mouth, cover their nose. Where when that happens to us, sometimes we think, oh, that's great. We feel all cuddly and snuggly and we're going to sleep really good. Babies don't have the means, they don't have the motor skills and the, muscle memory and all of the things that you need to get themselves out of a dangerous situation. So if they have a blanket over their face, they can't get away from that. So we just avoid the blanket altogether. There has been some things on the market too that are a little concerning. They have weighted blankets, they have them for adults as well, but they make them for children. And so it's kind of like a sleep sack that's extra heavy, and that's definitely not something that you want in the crib on your baby. So, if we lived somewhere like northern Canada, I don't know that it's really cold. Maybe that weighted blanket is something you need. I don't know, but we don't recommend any of that. Anything weighted on a newborn is dangerous for them for sleep.
Babies roll around and all that kind of stuff, and and it's just I have to say this. I used to get up in the middle of the night about 12 times to check the youngsters when they were in our house, and I'm thinking, oh my gosh, I walk in there and I'd look around, okay, and then rolled over and just all kinds of things that happen. So
yeah, for sure. I think that's which also can lead to, think about it. You just said you did it. We've all done it. Like you just want to go in and make sure they're breathing, right? And make sure that they're okay. And sometimes that doesn't stop just with a newborn. So think about your lack of sleep and how exhausted you get from that, right? Just constantly worrying about the safety of your baby. So we do recommend room sharing, but not bed sharing. So sometimes that kind of alleviates a little bit of that. So at least for about 6 months, even up to a year, you can keep your baby in your room with you, but not in your bed. So you can put their cradle or pack and play or whatever you're using for sleep in your room with you until you kind of get comfortable and confident in that. As far as the back to the stomach thing, and this is something, I don't know exactly what our audience is, but I know we've got grandparents out there too, and even just different generations. I know my children, we put them on their side. That was what we did when they were born, and kind of propped them up, and so that is no longer the case. And so explaining that to people, and even just with grandparents, and say we don't put our babies on their stomach anymore, and a few things come up when we discuss that, and one of the main things is choking. What if they're a gaggy, spitty baby, and what if they choke? And it's an excellent point. But just physiologically, the way the babies, all of us, are made is that you have two pipes. You have a windpipe and a food pipe, right? So your trachea and your esophagus. They are designed so that when you are on your back and you've got a gag reflex, that is going to clear your airway. Okay. And a baby that's gagging and choking is going to be noisy. So you're going to hear that. You're going to wake up and you're going to address that issue. Where a baby that's on their stomach, that reflux can easily get down the wrong pipe. Okay. And we just don't think about it that way. But when they're on their back, it's actually going against gravity to actually get into your windpipe. And so they're safer that way. The other thing that happens on their stomach is they're breathing their breathed out air. Right. So it kind of messes with their oxygen level, carbon dioxide level. So they're laying on their stomach and they're breathing out, breathing back in the air that they were breathing out. So, and I feel like most parents, grandparents, when we educate here in the unit, or this is something heavily I do in the community, you just have to explain, it's not that we did anything wrong when our kids were younger, or you did anything wrong. It's just that we learned a better, safer way to do things. And so, now, as your baby starts to roll on their own, you do not have to move them. You don't have to get up and place them on their back. When they're rolling on their own, you can allow them to do that. But we should always start on the back. in that position and keep them that way.
Jeez.
I know. We wonder how we did it, right?
Well, you can go down the road of seat belts and all kinds of crazy things if you start talking about stuff like that. So,
well, and I use that as a comparison often, honestly, because I think even just with my mother and my children, you talk about this stuff. I'd say, you also never used a car seat, Mom, and you would, like, would you put the baby on the front seat and just drive to Giant Eagle? You would never do that. Like, that's unsafe. And so that's all we're saying, is that we just learned a safer way to do things. And usually when you explain it, everybody kind of says, oh yeah, it makes sense. We're always learning, always evolving, but keeping up on that information is hard, which is why things like this are important, so that you can get messages out to large amounts of people. And that hopefully they share it with other people. They share it with other grandparents and share it with other neighbors and friends that have young babies around, so they can do their best to contribute and support families that have new babies.
Very interesting. One question in the middle of this. What is the most babies you've seen at one time?
Oh,
Odds?
like in a day, for whatever reason, and of course I don't write it down, but I'm thinking that we had maybe 16 in one day at one point. Here, it's a lot. It's a lot. I don't know if that's a record, to be honest. Those would be some fun stats to have, though, for sure. But yeah, I'm thinking, 8-hour shift, that's 2 babies an hour. That's a lot. We have about 50 babies a week, average about 2,500 a year. We're in the top 9 actually in the state of Ohio for deliveries. So yeah, we see a lot. See a lot of babies, but also on that, I think, it's great. It's good for job security, right? But also, we just have the opportunity to reach and touch all these people, and do the best we can to get everybody on the right start. We focus a lot on education and really just trying to encourage families to be the best they can and do the best they can right from the start. And so I don't see it as a privilege, an honor to be part of somebody's experience starting a family. It's one of the few things in your life you don't forget. One of the most important things you'll ever do.
Yeah, interesting.
Yeah. If I could, though, along the safe sleep lines too, just want to point out that we partner with the Stark County Health Department and Cribs for Kids program. So when someone comes to us, we are always asking if they have a safe sleep environment at home. Because sometimes we have, there are some social issues that exist, unfortunately, housing issues and, lots of other financial situations that are tough for people. So if they do not have a safe sleep environment for their baby, through this partnership with the Stark County Health Department and Cribs for Kids, we offer a pack and play to families at no cost to them. So we complete a lot of education, do some paperwork, and then we're sending them home with a safe place for their baby to sleep. So we say, I hate to put fear in anyone, but sometimes I think fear works. But I think babies, they suffocate. It happens. We kind of tiptoe around saying that. So nobody should feel like they're without a safe sleep environment. They have to put the baby on the couch because that's the only place they can sleep, and they suffocate in a pillow. So we have options, we have resources, and we want to make sure that everybody knows those are available to you. And actually, for this month, the Stark County Health Department has gifted us a sleep sack for every baby that delivers. They received a grant, and they have donated to us and our other local hospital as well, so that every family goes home with a sleep sack. Just to do what we can to get everybody out the door on the right foot, starting off with the right habits to keep our babies safe. It's a very important thing.
Very interesting. And it is time for our final break. You are listening to Health Matters with the Medicine Center Pharmacy. Back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. We're talking this morning with Christine Powell. Let's get back to the last minute of the show. Well, Christine, what do you tell a mother about breastfeeding and safe sleep? We already did the safe sleep.
Yeah. So breastfeeding has been shown by study to reduce the risk of SIDS and infant sleep issues. So we definitely encourage our families to breastfeed, but when they're able. Not everyone is able to, and that's okay too. Sometimes what happens though, when you're breastfeeding baby, you definitely have some hormones that make you extra sleepy. When you're providing nutrition to a whole nother human, that happens. So in order to avoid falling asleep, accidentally sleeping with your baby, we encourage families to maybe choose someplace else to feed other than the bed. That makes it so get out of bed to feed your baby. If you have a support person that can kind of help keep you awake through that time, that's great. Also, I've encouraged moms to use an alarm, on your cell phone, set an alarm so that if you are done feeding, you can, your alarm's going to go up off, and you can wake up and put your baby back in their safe sleep environment in their bed. So that is, we don't want to discourage safe sleep or discourage breastfeeding because of safe sleep. It's important that you do that. Just having some parameters in place for when you are extra tired and falling asleep, that you don't end up sleeping with your baby for that thing. Also, I want to mention too, I think, the safe sleep message has been out for quite some time. So I do think most people are aware of the ABCs of safe sleep and what you should be doing. And I think what we see sometimes too is that when your pediatricians or your OB physicians are talking about it, asking, moms know what the answer is supposed to be. So when they say, are you sleeping, how are you sleeping? Is your baby sleeping separately? I think sometimes they hesitate to be honest and say, I do fall asleep with my baby. I have fallen asleep in the bed. And so we just, we want to encourage people just to have those tough conversations, to say, yeah, I'm struggling. I'm tired. I have slept with my baby because that's the only way that baby sleeps. So instead of fearing like what your repercussions are going to be from your care provider when you admit, they're going to offer you resources. They're going to, give you help. So just having those honest conversations and saying, yeah, I have slept with my baby because I'm exhausted and I don't have any help. And then maybe we can find something for you, maybe we can find some way to get you some help so that you don't find yourself in that situation with a potential risk, putting your baby at risk of suffocation in that environment. So I think, like I said, just again, having the hard conversations, and I do think we're better at it than we used to be, but still a lot of ways to go because it still happens. We're still seeing cases. And so once we get rid of all those cases, then we can say we've done our job. But until then, we got to keep spreading the word and sharing the message and modeling the behavior and encouraging everyone on all those safe sleep rules.
How important is car seat safety? I noticed that you have to upgrade your car seat, as the child gets a little older. Okay.
For sure. So I believe last time I checked, I believe car accidents were the second leading cause of injuries in children. And so I think, when you're leaving the hospital, we have to ensure, that there's a car seat in your car and that your baby's going in it. Aside from that, we don't do any sort of inspection to make sure it's installed properly or anything like that. And they're pretty complicated. They've got all these new straps and tethers and all these things that we didn't have before. So it can be a little bit of a challenge. But making sure that car seat is installed properly and that you're using it properly is very important. So most of our local police fire stations will do inspections for you or installation even for you, so you can feel confident that it's in there properly. Some of them require appointment, but that's also another good resource is the Stark County Health Department. On their website, they have it's called Safe Kids, and they have the sites of where they do those, and they're kind of located all around Stark County. So most people should have access to a location near them to have that car seat inspected or installed for them. And you're right, Paul, they do graduate to different car seats.
Right. And the other thing is, how long does a child stay in a car seat?
Well, and that's changed as well. So the current rule is 8 years old, 80 pounds, 4'9" tall. They have to meet any one of those three requirements before they can come out of a car seat. So, so you transition, you go from the infant seat to the toddler seat to the booster, and then they can come out of that booster seat when they've met any of those requirements that were just mentioned. So it's a long time. I feel like I barely passed 4'9" tall. So, some of us maybe the weight thing we bypassed a long time ago, but the height, so you have to just at least meet one of those requirements before you can come out.
Okay.
All right, well, why don't let's see, we're getting close on time. I think it'd be important for listeners that are maybe just tuning in that you summarize some infant safety tips to families overall.
Sure, sure. So, to summarize and just kind of wrap it all up, infant safety, keeping our babies and newborns safe starts before they're even here. Sometimes before you even thought about them. So having that healthy lifestyle, and then prior to pregnancy, once you've found out that you're pregnant, making sure that you're seeking prenatal care, consistent and regular prenatal care, and following those, and then educating yourself on all the things that you can do to keep your baby safe, all the way from, the safe sleep, which we focused a lot on, car seat safety, home safety is an important thing too. Usually you've got some time because your newborns aren't really getting into the outlets and cupboards and toilets just yet. They've got some time before they're up and mobile doing that. But, we can just do our best and listen to all the resource and information. Also, along those lines too, I want to share that, using a reliable resource is very important. There are a lot of outlets now that provide information that isn't always medically accurate or research based. And so making sure you're seeking information from a credible resource is really important as well. And not being afraid to ask questions and having hard conversations.
You've mentioned a lot of resources Aultman offers. Can you share some of those, or maybe how to get in contact with you or your department? Or, I think one of the most surprising things you said to me was that I'll summarize that if you're a mother at your wit's end and you have no help, that you can actually come to the hospital and get some help, which I never knew was an option. So,
Right. Yeah. Yeah. So, and then again, like you said, you don't know it's an option. And if we don't know and we're here and in this world, how are other people supposed to know? And I think too, you get to a point where you're afraid to ask because you feel like some sort of, you should be able to handle it. You should be able to care for your baby. But um, anyhow, aside from all that, so yes, the emergency room is there for that. Those types of situations where we have emergent, concerns. Otherwise, we have just our regular website, aultman.org, and then there are tabs at the top. There is a service tab, and when you click on services, it says Birth Center. And then when you go to Birth Center, there is all sorts of categories that you can look at there, all from our class offerings to our phone numbers, contact information. And I can't tell you enough, Stark County has so many resources, and you just maybe sometimes need to find the right one. So if you're having trouble with that, we can help, with that too, just finding who you need to contact to help you. It's out there. Sometimes it's just a roadmap of trying to figure out who to get you to, but we're always willing to help out.
We're out of time, right?
yeah. Do you have time? Can you share the birth center phone number? Do you know that off the top of your head, or?
Sure. My direct phone number is 330-363-4250. I think that's an easier number. The Birth Center direct number has everybody in labor calling and whatnot. So send you to me and I can hopefully head you the right direction.
Wonderful.
Mm-hmm.
Okay. Thank you to our guest, Christine Powell. And she obviously is not in the nursery because we are hearing all kinds of crying.
No, I kept it. My door is closed.
So Christine has a Bachelor of Science in Nursing and RN with Aultman Birth Center. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. And we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you very much, Christine. Very interesting.
Thank you.